Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, Anambra State constructs barrier to prevent interstate movement as travelers are stranded for hours. More agencies join in distributing palliatives, NYSC, NDDC donating relief materials. And U.S. imposes travel restrictions on foreign nationals in Brazil as cases of COVID-19 grow in the Latin American country. As a precautionary measure to prevent the spread of the coronavirus disease, the president approved restriction of movement and interstate travels to stem community spread of COVID-19. Despite the order, a lot of businesses, including some markets, stores and people other than essential service providers, are seen moving around in disregard to government's efforts to flattening the curve of COVID-19. In the course of the program, we'll be taking a look at what the gains have been made by all the stakeholders involved. And 313 cases of COVID-19 have been recorded in 17 states of the Federation, bringing the total number of cases in the country to 7,839. This is according to latest figures released by the Nigeria Center for Disease Control, NDDC, which also puts the number of patients discharged at 2,263 with 226 deaths. Of the 313 new cases, 148 are in Lagos, 36 in the FCT, 27 in Rivers, 19 in Edo, 13 in Kano, 12 in Ogun, 11 in Ebonyi, 8 each in Nasarawa and Delta states, 7 in Oyo, 6 in Plateau, 5 in Kaduna, 4 in Kwara, 3 each in Akwa Ibom and Bayelsa, 2 in Niger, and 1 in Anambra State. A breakdown of the figures by region shows that Lagos in the southwest remains the epicenter with 3,505, followed by Kano in the northwest with 896 cases. The Federal Capital Territory in the north central region has the third highest tally in the country with 505. Borno State leads in the northeast with 250. Edo in the south-south with 191. Ebonyi overtakes Enugu in the southeast with 33 cases. The pictures you see there, men of the Anambra COVID-19 task force manning a gate constructed at the foot of the Onitsha end of the Niger Bridge, barring motorists, commuters from entering the state. This in turn caused a long gridlock as motorists were compelled to wait for several hours before the gate was eventually opened by the task force. Now, the reason for the barrier is to prevent travelers from entering the state during the COVID-19 pandemic. The governor of Anambra State says all efforts to prevent people from flouting the interstate restriction order had failed, leaving government no choice but to lock up the bridge.
The challenges we've encountered is movement of people. Movement of people, we have plenty traders in Asaba. So they always want to come and do their business in Onitsha. So they are our challenges, but we've been able to sensitize them and create an awareness for them to stay at home and obey the government's directives.
Our correspondent, Etokwe Kuteyi, is in Imo State. He brings us this update on the lockdown compliance from the state capital, Owerri. Well, we'll bring you that correspondence report from Imo a little later on. But let's bring you this story. It's the major government health facility in Lafayette, the Nasarawa state capital. That's the Dalhatu Ara Specialist Hospital. And it is engaging more than 50 young persons in the mass production of face masks for personal and revenue purposes. The Deputy Director Administration of the hospital, Mr. Ahmed Mohammed, told Channels Television that the scarcity of the surgical masks in the market and the compulsion of its usage by the government prompted the hospital to look inwards. He said more than 10,000 masks have been produced in the first batch, and the hospital is looking at producing more than that number in the second batch, which is currently underway.
Because of the COVID-19 pandemic, that was one of the major reasons for us to start producing our face masks. And you know, when it started newly, because of the scarcity of the masks, it became so expensive in the market. You can't even find it. So as a hospital, the CMD said, okay, yes, we have to look in-house to see how can we protect ourselves, protect our patients, and even the general public. That is how we started the whole idea. The second batch, it depends on the patronage of this. But like now, a lot of people are patronizing it because our max is not just an ordinary max. We took a lot of things into consideration. We have the filter to give it more, more value and more protective measure.
And it's back to Imo State. Here's our correspondent, Tokpe Kute, with the latest.
Imo State, as of today, has no case of the coronavirus disease. This is according to the state task force on COVID-19. Out of the 7 cases earlier recorded in the state, 3 were discharged, and the remaining 4 cases, which were said to be from one family, were travelers traveling through Imo State and were never taken into isolation or quarantine. According to the state chairman, Professor Maurice Iwu, they've gone back to their destination and never made contact with anyone in the state.
Plan on Interstate. Yeah, they came here from Lagos. How they did it, I just don't know. But we had a plan that you must be tested once we find you here by any chance.
Meanwhile, in a recent broadcast, the state government has given families a 2-week window to decongest the mortuaries across the state and bury their corpses in accordance to the laid-down rules and regulations by the state government.
Due to pressure from the operators of mortuaries in the state, insisting that their facilities are filled up to the brim, we have decided to allow families who have corpses in the various mortuaries to bury their relations.
Even though the temporary easing of the lockdown and the 6 p.m. to 6 a.m. dusk to dawn curfew is still in place in Imo State, but the government is still vigilant and putting all measures in place to contain the spread of the coronavirus disease in Imo State. From Owerri, the Imo State capital, Tokpe Kute for COVID-19 update.
Thank you, Tokpe. The Ogun State Office of the National Youth Service Corps, they've donated food palliative to the Federal Medical Center, Abeokuta, and the Stella Obasanjo Children's Home as part of its 47th anniversary and establishment in the state. Presenting the stimulus to the management of the 2 centers at different occasions, the State Director of the NYSC, Mrs. Belinda Fanny, said the gesture is to mitigate the effect of the current lockdown occasioned by the coronavirus pandemic. She, however, seized the occasion to admonish Corps members to continue to foster unity among their host communities while making themselves relevant in the current challenges created by COVID-19.
The NYC has been doing so much, promoting unity, getting jobs for Corps members because they are developing them to become self-reliant. A good number of our Corps members today, they are into production of so many things, bags. Those that are sewing are sewing. Our Corps members, too, produce face masks, which they also donated to the state governments, the less privileged in the society. And they've been going on sensitization exercises in the public, all over, helping both the federal, the state government, and the local government to create awareness about the programs of federal government in the nooks and crannies of the states and the country as a whole.
The Niger Delta Development Commission, NDDC, has kicked off the distribution of medical supplies, relief materials and public enlightenment campaign to contain the spread of COVID-19 across the Niger Delta region. Speaking at the flag-off ceremony at the NDDC warehouse in Transamadi Industrial Layout, Port Harcourt, the Commission's acting managing director, Professor Keme Brady Kumoponde, laments that the poor state of health facilities in the country, and specifically in most states of the Niger Delta region, was a major constraint in the fight against coronavirus.
The bulk of this package is actually medicals, equipment that will be sent to beef up the challenges of this coronavirus thing. The thing is spreading, whether we like it or not. Even in River State, we're surprised that the number has gotten to the number above 50. And in some states, over 1,000. So there'll be a point at which even the medical equipment present in the different states will no longer be possible. So that's part of this intervention. The other part includes the food items, which will be distributed to the different states. And we want to plead, as we said, during the inauguration of the committee that has done a very wonderful work, developing a template for equitable distribution to make sure that this thing gets to those who really need it.
So it's daily troubling images and videos of people other than essential service workers traveling across different states in the country in clear violation of the state travel ban. Joining us, our guest is Dr. Bakia Yesufu, a public health physician. Thank you for joining us.
Thank you. I'm glad to be here again.
All right. What's your take? I mean, the ban is to help us fight COVID-19, but we're seeing more people moving around, which is also spreading the coronavirus.
Yes, thank you. Basically, the initial issue was that we needed to reduce people from moving around. That was why there was a lockdown in the first place. And unfortunately, we haven't been seeing the effect of our ease of lockdown. The plan is to ensure that people have stability, both in their businesses and in actually getting sure that they do not get infected with this disease. But as it is right now, it's obvious that it's not working, and the Lagos State government has tried a lot to put things in place to ensure that people keep up with these rules and make sure they are safe. But I think the way it's going now, we have to start looking at other measures to ensure that the disease is
And that's what most people are wondering. What are the other measures? Should we have security agencies strictly enforce it? They say they are doing that, but, you know, we're seeing that it's not working. Should we have the Presidential Task Force go again reviewing their guideline for the ease of lockdown restriction?
Well, basically, what I think will work for us is if we have this enforcement being supervised all over again. Us going back to our pre-lockdown times,
total
lockdown might not be effective right now, because we need to start looking at how to live with this disease and, you know, make sure that we are back into our daily activities. So they need to actually be strict with the enforcement and be sure that the enforcement agencies are being looked upon too. So
I want to quickly ask you about our testing. We're almost looking at testing 50,000 people so far. I know we're still using the most reliable testing method, but are we testing fast enough?
Well, basically, the Honorable Commissioner for Health in his remarks some time ago spoke about us, you know, resourcing for our reagents outside what we have been doing. And in that manner, we'll be able to get more test kits available to us. So with the test kits being available, being resourced locally, there's going to be a very, very drastic change in the rate at which we test.
And how soon would we see that?
It's ongoing right now. It's ongoing. So we hope that in the nearest weeks, we should be able to have completed those things concerning reagents and tests.
We'd like to appreciate your time. Dr. Bakia Yesufu, public health physician, thank you for joining us.
Thank you for having me.
So to come on the COVID-19 update, the Executive Director, ECOWAS Regional Center for Disease Control, Professor Abdulsalami Nasidi, joins us on the program. That's in a moment. Welcome back. Some COVID-19 patients receiving treatment for coronavirus at the Stella Obasanjo Hospital's Isolation Center in Benin City, the Edo State capital, have praised the state government for what they describe as quality healthcare services given to them. One of the patients who has been discharged shared his experience after testing negative twice for the virus.
To use this medium to do people and Nigerians that please make yourself available for screening. And from screening, if you test positive, please just don't lose hope. Just know that it's just one of those things. And that you are positive does not mean you are dead. It's not a death sentence. It's just heard from him. And when we were inside, I can see that in a few days, many of them in there will also be out because they are in top spirit. And please, let us wear our masks. Let us follow the protocols. That is the best way to avoid being positive. But if you are positive, it is not a death sentence. You will be out by the grace of God.
The Deputy Governor of Edo State insisting on the precautionary measures. Well, let's take you to what other states are doing. Cross River State governments, they are intensifying the border closure as part of efforts towards maintaining a zero incidence case on COVID-19. And the state government is enforcing the no entry order into the state with improved surveillance at various entry and exit points. The Cross River State Commissioner for Youth and Skills Acquisition stated this at a boundary community between Cross River and Benue State, which serves as the only route leading in and out of the state from the northern part of the country. Over in Kano, the Governor, Abdullahi Ganduje, has pardoned 300 inmates as part of activities marking this year's Eid al-Fitr. At the Goron Dutse prison facility, Governor Ganduje says the gesture is part of the ongoing decongestion exercise directed by the President over the COVID-19 pandemic. And as the rainy season sets in Yobe State, the government has flagged off the distribution of agricultural inputs to 2,000 households in Buniyadi, the most ravaged community by Boko Haram insurgency. This is to improve farming in the community. The governor, represented by the Commissioner of Humanitarian Affairs, says the items were procured by the UNDP and the distribution will be done in 10 phases across the local government, and they are to observe physical distancing during this pandemic. Now, Professor Abdulsalami Nasidi is Executive Director, ECOWAS Regional Center for Disease Control, and he joins us now from our Kano studio. Welcome, Professor. Thank you for joining us on the program. Let's begin with the cases we're witnessing in the region. What's the COVID-19 response at the sub-regional level?
Actually, good afternoon, but I must correct the impression I was the first or pioneer executive director of the ECOWAS regional CDC, but I'm no longer the executive director. I'm now the provost of College of Health Sciences, University of Africa in Tororo, Bayelsa State, and also advisor to the Honorable Minister on COVID-19. Nevertheless, generally the incidence or prevalence of COVID-19 in the African continent is something that is of interest to the whole globe, and we are, to say the least, we're much luckier than most of the other continents, and the spread of the infection seems to be a little bit slower, or our ability to actually test and establish the true situation is not very strong. Nevertheless, most countries have now increased their capacity to test, and we are seeing more and more cases, and few more deaths coming.
What are your thoughts on Nigeria's response? In the midst of it all, we've imposed travel restrictions, yet we're witnessing a lot of abuse on people still traveling, and we're still seeing cases by the day of the virus. Do you think that our measures, our partial lockdown ease, is working?
It's very difficult to assess. Unfortunately, it's not working as we would have loved it to work. This is the fact that, some of the measures taken were not evidence-based, were not based on some scientific findings. The virus has escaped into the community, and the approach to actually, curtail the transmission of that virus within the community is a little bit different. At the same time, of course, unfortunately, many of the communities in the country we have not attained 100% acceptance. Some of the communities, some of the states are still in denial. So enforcing the restrictions, the lockdown, had not been effective, very effective as in other places. I wish, many states could have copied from Lagos in particular and Kaduna State as far as lockdown is concerned.
But apart from all of those measures, what more support do you think that the NDDC and the EOCs need to indeed curtail the spread of the virus?
Well, as you know, Nigeria with about 200 million population, the NDDC staff strength now needs to be fortified. Also, the capacity, to carry out the following activities must be, increased many times so that they could actually meet the challenges of the high transmitting areas and to prevent those areas transmitting more viruses to currently low transmitting areas. One is to ramp up the capacity to test, which the NDDC is currently doing, and two is to expand their capability to assist states and local governments to actually carry out effective case search, active case search, contact tracing, and of course, isolation and treating of the patients.
All right, we appreciate your time, Professor Abdul Salami Nasidi. We do apologize earlier for the error, but you are the first pioneer. We appreciate your time. Also, the Provost College of Health Sciences. Thank you for joining us.
Yeah, can I say one?
We wish you could, but we're running out of time. Hopefully another time. But the United States has suspended travel from Brazil, the world's second largest virus hotspot. In the meantime, a number of European countries are further lifting their restrictions on Monday. We hear gyms, swimming pools reopen in Italy, except in the hardest hit region of Lombardy. Spain's two biggest cities, Madrid and Barcelona, both made the move into phase one of the country's three-phase lockdown lifting plans. Take responsibility in protecting your health. The message from the NDDC. The website has all the information and statistics on the cases across states with regular updates on the COVID-19 regulations. Also, the World Health Organization says physical distancing is one of the most effective methods to limit the spread of COVID-19. Of course, you can stay home when possible. Maintain at least 1 meter distance between yourself and others. The website has rolling updates of the pandemic. Our website, channelstv.com, has the latest news. All you need to do is log on, access the news and health, politics, business, sports, Africa, and around the world, all at your fingertips. That's the COVID-19 update. Thank you for watching. I'll be back with another update at 6 p.m. Until then, I'm Millicent Wonwoka. Bye for now.